Well, good evening. Welcome to Black Men Speak, a podcast that highlights ordinary black men doing extraordinary things. I am your host, Keith Dent, and I'm glad you guys are here today. Let's see, this past year, we celebrated 50 years of hip hop, but unfortunately, we lost some important hip hop artists during that time. Trugoy the Dove, whose real name was David Jolicoeur. And it's very oddly enough, just this past year, they had just released their music on, the streaming channels. DMX and Magoo. Well, DMX died as a result of a drug overdose. Both Trugoy and Magoo died of illnesses that might have been prevented if they took better care of their health. So our guest today, Dr. David Griffith, being a true hip hop fan, took the death of these men to heart, as well as a lot of people. Others like Malik Taylor, better known as Phife Dawg, who had died, a few years ago, as well as Big Pun and Heavy D, and they had heart-related illnesses. But is that really a microcosm of what we're seeing in amongst our black men in our communities? And we're going to talk about that on today's show and what maybe some are going to be some of the remedies or what we can do about that. Dr. David Griffith is the director of the Center for Men's and Health Equity at Georgetown University, my alma mater. And it was established in the summer of 2021 in the Racial Justice Institute. And so the center studies how social and cultural factors shape men's health. So I can't wait to really talk about this, especially, how he felt about the hip hop legends and then, just some of the issues that he's seeing in the community. So Dr. Griffith, how are you doing today?
I'm well. How are you?
I'm doing great. I'm doing great. It's a little cold, but
hmm
where we are, and I know in DC, I'm sure it's cold too. We used to hate winters in DC because that wind would start whipping up the Potomac, and that's just a recipe to stay indoors.
That's
So
right.
so I just wanted to, because I mentioned the deaths of the several hip hop artists, and they were, an article that I read, and this was very heart wrenching for you. So I'd love to hear why that was.
Yeah. Well, first, thank you for having me on the show, and thank you for bringing up this particular topic. I mean, I think anytime we lose these kinds of artists, whether they be music or other types of performing artists and so forth, you also sometimes mourn the loss of the art and mourn the loss of what they also may have been able to contribute going forward. What are some of the music that we didn't get to hear? What are some of the things that they could have done in other areas of their lives? So it's really just the loss of some of that feels almost selfish to me, that I'm focusing more on more selfishly what could I have heard from them that would have also been particularly powerful and influential for me, but um, just also thinking about their families and loved ones and so forth, that there's just a lot that they, as people and as artists, that we are missing when we've lost these men at this point in their lives.
Okay, okay. Yeah, so I mean, I'm gathering you grew up around the era that I did. So who was your favorite artist? Who was your favorite rap artist?
See, now you really get me in trouble. I mean, you see, I have the De La Soul sweatshirt on
Okay,
today.
yeah, yeah.
Definitely Tribe Called Quest. I mean, I grew up in Atlanta, so I can't, not talk about the groups like Outkast and so forth. I mean, so yeah, if I'm gonna ever go home, then I have to talk about them. But
Right,
was
right.
definitely a fan of those. Public Enemy, X Clan is another one. So yeah.
And I don't want to go down the rabbit hole, but do you because we could probably talk about this for a while. But do you
Mhm.
like Andre's new do you like the new album? Have
I
you heard
haven't
of
heard it. I haven't heard it, honestly.
it? Okay, yeah, you got to check it out.
Yeah,
You got to
yeah.
check it out. But
Okay, okay.
um, you'll be mellow. No, that you can use it with you can use it for as far as a mental health study. So there
That's
you
what I've
go.
heard, yeah, yeah. Mm.
um, so yeah, so I think one of also the things that I found was that black men usually, for the most part, are dying from preventable deaths. So what are the three or four major um, illnesses or that we as black men are suffering from the most?
Well, the leading cause of death for Black men are really very similar to that of most other Americans. So it's, typically heart disease, different types of cancers. In this era, or at least with the most recent data that we have from 2021, COVID was the third leading cause of death for most people. Then you have things like unintentional injuries or accidents. And for Black men, one of the things that's unique is homicide is one of the top five leading cause of death.
Mm.
So um,
And that's usually for the younger age groups, correct?
it is, but it's concentrated there. But if you're looking at Black men overall, it somehow it because it's so high in younger men, it actually makes the top five overall with Black men.
Oh, okay, okay,
Yeah.
right.
But it's yeah, the concept it was interesting as I was preparing for this. The concept of preventable deaths is a really tricky one because we're gonna die, so you can't prevent death, period.
Right, right,
It's
of
just a
course.
question of,
Of when.
when are you gonna die, how ill are you going to be when you're living, and what are the kinds of things what's your quality of life during that whole period? And so how do you think about what those things are? And unfortunately for a lot of Black men, we tend to die in this middle age period or um and so it's a question of why are we dying, disproportionately before the age of usually retirement, like 65.
Mm,
We have a very higher than most other groups of men or women rate of dying before the age of 60, 65. And so that's really one of the bigger questions is why is the clustering of all of these different things? And you mentioned all the different things that the different hip hop artists died from. It ranges from everything from homicide to heart disease and so forth. And so it's not just one thing you can put your finger on, but we have to understand, what is it about being a Black man that puts you at risk, disproportionate risk for all of these things.
and it's interesting. I mean, and I know we have a lot of things to talk about, but just like for example, let's take Big Pun, right? I mean, his name was basically what made him. I mean, his talent, but
Hmm.
he was the name.
The
And
persona.
so,
Yeah.
how do I'm just wondering how he could have really done anything about that because it would have, in a way, might have messed up, the thing that he was known for.
Well, you think Heavy D is the same thing.
Right.
I grew up in the era of the Fat Boys. I mean, all of
Right.
these are, they played on that. And you've seen, even thinking about other types of artists, actors, and so forth, Anthony Anderson, I'm blanking on the comedian's name now, but he lost a lot of weight. But a
Hmm.
lot of folks have had to make these decisions about, and it's not the decisions about do I continue to utilize this identity and this thing that while it's lucrative for me professionally is harmful to my physical health and may lead to my premature demise.
Hmm.
And so that is actually a useful microcosm of a lot of the things that we deal with in men's health and particularly Black men's health more generally, which is do we continue to provide, focus on the things that are good for us professionally and prioritize those and sacrifice the attention that we need to put to our own physical health and mental health, at the same time. And
Hmm.
so we also are making those choices. It's usually not quite as visible and quite as obvious as, we talked about another um, colleague of both of ours who lost 200 pounds. It's usually not quite that dramatic, but
Hmm.
you do
Right.
have these folks where you're making these choices about, how much do I focus on my health versus focus on my professional success, investing in, energy into good things, not just necessarily always bad things. We're trying to promote an identity that is masculine in a way that is supposed to be negative.
Hmm. Hmm. Right. Okay. And so, yeah. So, give me a little bit. a background about the Center for Men's and Health Equity, and what was your journey to getting to being the director? Why do you feel it was important for you to, I guess, to focus on this?
Yeah, I mean, I've been focusing on these areas for more than 15 years or so. Um, and I said ooh only because I'm thinking about how many years that is. But it really just started with recognizing that um, Black men and Black men's health issues were kind of to use a term that came from focus that actually we've learned from Black women and Black womanist and feminist sort of literature, intersectionality. You talk about centering the margins. And the idea is basically if you look at what is at the margins of health equity, and particularly usually that's focusing on race and ethnicity, that Black men tend to be at the margins, or gender as it relates to males and men tend to be at the margins of that conversation. When I looked at men's health, and it tended to homogenize men and treat all men the same, or you about Black men in that context either. Yet the data would have suggested for either group that Black men were dying at far higher rates than Black women, and certainly far higher rates than white men. And so there was a need to put the energy and spotlight on Black men because those things weren't happening. And so the center was just a way to sort of highlight that as a starting point, not to make it the only place that we focused on different populations. We also do work on Latino men, and actually do have done work that has direct implications for white men's health as well, and other groups of men, even
Hmm.
outside of the US. But we wanted to start by centering the folks whose health tended to be worse and that we actually had good data on. The other group we haven't really done as more indigenous men, just because we don't have the good data and access to a large population of those men, but have done some stuff with indigenous men in New Zealand. I better not mix those up. In New Zealand,
Right.
and Australia, actually, for that matter. But yeah, that was kind of how the center started. Was really I've had centers at other institutions where I've been, and I just wanted that was an important part of my identity and the need to where I saw the efforts to address health equity needed to include, and we haven't seen that many people. We're actually starting to see more junior scholars focus on Black men,
Hmm.
but when I started doing this 15 plus years ago, there weren't that many of us around who were focusing on Black men. And it was actually seen as quite a risky proposition to focus your career on a population that most folks didn't think were necessarily valuable.
Hmm. Wow, that's pretty deep. Because I know in some of the research that I had was doing, especially for our my previous show, was that there wasn't a lot of data
Hmm.
um, that could be used, especially for like prescription drugs and things of that nature to help the population. So I find it fascinating that you know there's a population out there where it could support um, Black men, but it was hard for individuals to find data. But you basically are kind of saying the opposite, since you've been focusing on this, that the data is there. It's just a matter of the people that want to find it being able to, or
It's a
connecting
little
with the right people.
it's a little bit of both. I mean, when we look at there are very few data sets that we use to inform policy in the United States that usually looks at sex and gender and race and ethnicity simultaneously. So usually in most tables when we present data or see data from like CDC and so forth,
Hmm.
they have one set of lines that's about race and ethnicity, and then you have a separate set of line that says sex or gender. And what I'm saying is um, things like life expectancy, premature mortality, you tend to see the crossing of those two. So you actually will see lines for Black men, Black non-Hispanic Black men, non-Hispanic Black women,
Hmm.
Hispanic men, so and so forth. But for most of the normal data sets on like heart disease, cancer, so forth, you don't tend to see that. And you only tend to see here's for African Americans, here's for white Americans, here's
Mm.
for Latino populations, or yeah, Latino populations. you don't tend to see the crossing of those with the gender variable, and so you do tend to see that invisibility that you can't see. And we've seen this with Black women's health as well. It's just that I'm turning the lens a little bit to focus on Black men for a different set of issues, but we've seen that with Black women being invisible in a lot of health areas and health issues, and so their health is also suffering. And again, this lens of intersectionality really comes out of studying them and the scholars, the Black women scholars who have really been pioneers in that space.
Okay. Okay. And so, yeah, and that's kind of shifts the conversation a little bit about just men in general. Um, because I guess in today's times we have so much access to information. There's more doctors, especially Black doctors, than there were before,
Mm-hmm.
when we had challenges, with the syphilis study and not trusting the medical system. Why are we still having the same challenges that we had back then with us not trusting the medical system, and then the fact that we have access to more Black doctors?
So I'm actually not sure because there have been the data are sort of not consistent about whether or not there actually are more Black doctors proportionally to, say, even when we lived during an era of Jim Crow segregation. And so more, let me start with the first part. More is about quantity, not about quality. So while we have access to more
Mm,
information and potentially more providers, we don't necessarily have access to better information and information that we see as directly relevant to the populations that we're talking about in terms of Black men. So colleagues like Stacy Loeb, who's a physician at NYU, I've been working with her on the various studies, and she's the lead on this, looking at representation of prostate cancer information content online, for example. And so looked at 150 websites, 150 videos about prostate cancer, and not surprisingly, very few of them, probably only about a third of them, had somebody that looked and was perceived when she had a panel of folks look at the videos and do you see a Black person basically represented in the video? And only about a third of those had actually somebody that appeared to be Black in those videos
mm,
on the websites, and even less than that, probably about a fourth had some kind of Black representation in terms of videos. So it wasn't seen as directly relevant. And so when Black men would see it, they would look at that information, but they weren't always clear because sometimes they wouldn't explicitly address the fact that for prostate cancer, simply by being a Black man, you are at higher risk than other groups of men for potentially having prostate cancer and dying from prostate cancer.
oh, I
But
see.
that's not necessarily factored in there. And so between the representation and the lack of explicit attention to, yes, this is the general sort of sense of how we need to understand this, but we don't have good data on, you're not speaking directly to me. My risk is fundamentally different and higher than these other folks that this video is designed for, and this information is designed for. You're not attending to my specific issues and needs. And so the more and the better and the appropriate are not always aligning. And the relationships
Okay.
with physicians, there are more doctors, but they're not necessarily more accessible to Black patients. Um, and a lot of folks just are not going into those kinds of, particularly primary care areas and so forth. We actually arguably had better access to physicians when I don't want to say, well, I'll just say it because I believe this, but um, during segregation, we actually, in some cases, had better access to Black physicians because we
Mm,
were actually had to go see them.
right.
And we had to, and they
We didn't
lived
have a
in our,
choice. We had to
we
go.
didn't have a choice, but
Right.
it also facilitated, you had facilities that actually understood Black patients. You had facilities with physicians, nurses, and treatment teams that actually understood their patients. They had relationships with their patients, and they had a level of expertise of how to understand the uniqueness of that particular population, that now that we've desegregated,
Hmm.
we don't have that same kind of expertise with with Black populations, for example, and certainly not with Black men. And so it's a far more complicated picture.
Mm-hmm.
in that regard. And so, yeah, that's why I said it's a little more complicated. Just because we have more access to information, people have to sift through and figure out, is the information accurate? We have as much misinformation or disinformation where people are actively trying to give you poor information or inaccurate information, as you do folks who are just trying to, just promote different products and so forth. So it's like
Right. Right.
it's a lot more complex of a field to navigate than before we had the internet.
Okay. Yeah, and so interesting because I wanted to double down on what you said earlier about having access to the information because I watched actually CBS Sunday Morning today, and they talked about prostate cancer because the attorney general, is that right, or um, who's black, who has prostate cancer, and then they're talking about
Oh
King
yeah.
Charles, yeah,
Hmm.
and so they mentioned black men are susceptible to getting it. The disease, but I was like, well, how many black men were actually watching CBS Sunday Morning? So,
Hmm. Hmm.
it's quite interesting to, it's a great thing to ponder. Or, I mean, are the shows where we may watch, are they talking about prostate cancer more and how it affects, black men and more is more prevalent. So,
Hmm.
um,
And often more deadly.
right, absolutely.
Hmm.
And so one of the things that I wanted to turn to is more kind of the mental aspect of manhood. And I think came across an article where we needed to unlearn some of the principles of manhood. So like we're expected to be tough, not show emotion, not ask for help, be resourceful and figure things out along the way. And so I mean, I know in your studies, where, and we could talk about the program that you just embarked on in Atlanta. Were
Hmm.
those some of the components that came out in some of the discussions that they had as a group?
Yeah. So in my work, we've talked about what you're getting at is this conversation about gender and how does it apply to males and men. Um, and how do we think about things like ideals of what it means to be male, and I distinguish that from being the ideals of what it means to be an adult man. The ideals of what we expect of males, when we train little boys to, if they fall down, don't cry, dust yourself off, don't worry about it, it's only an arm, it's only a leg, you got another one, just keep going. Those kinds of things are those are sort of standards that are not age specific. Manhood is something that actually includes an adult component. And those are not necessarily the kinds of things that we're talking about here. Because when you think about the things that you aspire to be as an adult black man, that you admire in other black men and so forth, it has more to do with being responsible, with being
Mm-hmm.
caring, with being loving, with, being accountable. Um, being honest, trustworthy, those kinds of things. So it's a different set of criteria, and often those are more positive things that you're trying to balance and aspire to be, in addition to some of the other things that you're describing in terms of, can I drink you under the table, which tends to be something we used to aspire to do, perhaps in your younger years, college age, and around those kind of things. Can I do things physically that are stronger, better, whatever, that
Mm-hmm.
demonstrate my physical strength or strength of character and so forth. So there are a lot of those kind of things that get mixed in there together. So in our work, we've tried to disentangle those and try to better understand, how do men connect, particularly black men, how do they connect those ideals to health? And how do we work backwards from that to help them more explicitly connect? Well, if you want to live a longer, healthier life, if you want to, be more active when you actually come home and not just be collapsed on the couch
Mm-hmm.
and be a couch potato because you're exhausted from your day at work. If you still want to have the energy to actually engage with your kids, engage with your spouse or partner, then you may need to do things that actually require that. You would need to eat differently. You need to actually get adequate sleep. You need to actually make sure that, you're physically active if possible. Like all of those kind of basic things, you tie them through that lens of what are you actually trying to achieve? What is actually important to you? And those tend to be more positive things than the things around masculinity tend to be more of the negative stereotypes that we tend to see and talk about more generally. But those aren't usually how men think about what it means to be a man as it relates to health and what it means to be an adult man, and particularly an adult Black man.
Hmm. So let me get this straight. So when we view manhood kind of as adults, or some of us, we look at it more the physical, tangible things like being strong and being able to provide, but not necessarily the kind of the soft skill and tangible things that are necessary to make the family, well, make the families whole, but things that you'll need to interact better with your kids, your partners, and require a little bit more, I guess, if you want to say, caring and heart related things that may help to reduce some of the heart ailments that you have, or the health ailments, sorry, that you have.
So actually all of what you just described to me fits under the umbrella of manhood, meaning that these are the aspirations of what you'd expect of an adult male.
Okay.
These are the kinds of things that adult males would do. If you think about what are the ideals or what are the kinds of characteristics that you might expect men to check off as boxes from if they're 8 or 80,
Hmm.
those are the kinds of things about being strong, being tough, not asking for directions and so forth. Those are not age specific.
Okay.
When I'm
Right.
saying that those kind of things that you were characterizing as soft skills, communication, caring, relational, or being attentive to family, loved ones, and so forth,
Mhm.
those are all things that to me factor into the men that we've interviewed and done focus groups with. They're consistent with what they see as what they're aspiring to do and to be, and for people to know them for and count on them for as adult Black men, as
Okay.
Black men, as opposed to being a Black boy or child.
Okay. And
So
so
it's the age part that becomes a really important marker of what defines you as a what the characteristics that you're aspiring to demonstrate for yourself and to other people
mhm,
and to be accountable for when other people see you or they know, okay, yeah, I know my dad is going to be there 10 times out of 10. I know he's going, they're going to do whatever they can do to take care of this, take
right.
care of me, whatever. Those are the kind of things. It's not about being tough and strong and whatever. It's not. I can count on him.
Yeah. Okay.
Yeah.
And in your studies, when did that kind of start to kick in, as far as
We
eh,
haven't gotten to that. That's actually a great question. And that's one of the things that we want to better understand about younger men is when do they add that? Because it
oh,
does
okay.
because the complicating is like what you're saying, still a lot of men in different depends on the context of what you're trying to do and why. So, when men get together, you may still try to say, okay, let's see, some version of let's see how much we can drink. Let's see how many cigars we can smoke. Let's see, whatever things that may be unhealthy. Let's
Right.
see how fast you can drive a car. Let's see, whatever. Those things may still persist and exist. But then there's another side of you that is trying to be an adult man where you're still like, I still love my family. I still want to care for my family. I still want to be there and make sure I'm taking care of their both, basic needs in terms of having a roof over their head and money that they need or whatever those kind of financial and other provider role sort of things, but also just the availability, accessibility of being there for
Mhm,
your
mhm,
family and so forth. So those are things that are added to that, and we don't really know or haven't studied yet what age at which that happens.
mhm. Okay. Okay. Makes sense. It makes sense. But yeah, that'll be a great study. I look forward to hearing more about that, because I think, especially, and you hear a lot of, especially from the, because I do relationship coaching, so from that side, you hear about, oh, men haven't grown up, or we
Hmm.
still have this challenge. So is it because of the lack of those skills that we have been able, that we need to accumulate in order to make our relationships better, not only with partners, but our children and things of that nature, the things that cause kind of the friction in the first place. And
Mhm.
so it'd be a great study to hear about.
Yeah.
But I know that one of the things is the being our own advocates as far as the doctors, because of
Mhm.
course, as you mentioned earlier,
Mhm.
that even though there may be more Black doctors, or we may not just have that access, depending on just the way our healthcare system operates, and they're not concentrated in the areas of where we live. So how can we as Black men be better advocates for our own health? Because if we're dying of these diseases that can be treatable, we have to figure out how to work within the system. So
Mhm.
what are some of the things that we as Black men can do?
Well, I think some of it is realizing, first of all, that a lot of the things that will make you a better advocate when you go to the doctor's office are really requirements of you to do things outside of the doctor's office. So having being well informed when you go to the doctor's office is important, but if you're not, again, getting adequate sleep, if you're not eating, trying to eat a healthy diet, trying to be physically active, trying to take care of yourself outside of the doctor, there's nothing really that the doctor is going to be able to do to patch you up to really do these kinds of things. Physicians are really tend to be there more for fixing problems than necessarily preventing problems.
Mm-hmm.
If you're going to prevent problems and you're going to keep yourself healthy and you're going to work with your doctor as a partner in that work, you've got to do your own work outside of the doctor's office. You can't just go to the doctor and expect them to give you some drugs to patch you up and fix you back together, put you back together. So some of it is knowing what you need to do and being accountable outside of the doctor's office to do the things that you need to do to take care of yourself, in addition to going to the doctor to answer your question and being informed about what are the kinds of screening tests I need to get at certain ages? Um, what are the kinds of things I need to be doing to manage, my hypertension risk or high blood pressure risk? What are the kinds of things I need to know about Let me say this a different way. The doctor's office is a place to get information that you can't get by living your life. So the
Okay.
reason you go to the doctor, even when you're feeling fine, which is a lot of Black men, when we've talked to them in, again, interviews, focus groups, or small groups and discussion groups, um, I've had a lot of Black men say to me very proudly, "I haven't had to go to the doctor in 10 years." And I'm like, that is not, and I'm trying to find a nice way, because it's,
Okay.
when you're
Wow. You're right.
gathering information, it's not the place to correct information. But, at some point we try to find a way to bring that in. Well, that's not actually a marker of success. That means you're less informed than somebody who has been to the doctor and more recently than you have. Because there's things about the way that you feel that cannot tell you what's going on in your body, and the doctor's office can give you information about things that you can't see, you can't feel, but that are going on, or you can't identify and pinpoint. That's what you go to the doctor's office for, even when you feel fine. That's why you go to, the doctor's office for regular well-man visits,
Mm-hmm.
is to get information about how is your blood sugar, how is your blood pressure, you know, how is your cholesterol, and other things that are going on in your body that you're just not going to know from getting that information. So some of the answer to your question about being a better advocate for yourself is to go to the doctor even when you feel perfectly fine, to make sure
Mm-hmm.
that you get the screening tests and the information, and that you understand, and that you sit and you ask enough questions to make sure you understand what are the things I need to do and I need to be accountable and responsible for, to take care of my health, and who do I need to help put in place in my life to help hold me accountable. Now, we don't necessarily always want to have, often we know that, and my girlfriend loves to remind me about this, because I think I'm the one who said something to her about it. But that men who are married, or partnered or married in particular, tend to live longer than those who are not. Um, and so part of that is because we don't know actually the secret sauce mechanism for it, but we do know that probably it seems to be that some of it is caring for things like eating healthier food and making sure that you are taking care of yourself, going, making appointments for doctors and those kinds of things, taking care of those basic needs
Mm-hmm.
and so forth. And so you have to be willing to be held accountable for those things, even though we tend to not like it, we tend to benefit from it. And so you can't sort of, harm the
Right.
messenger, when they're trying to help you. We don't always respond well to that. And I know that's a hard thing. I'm not, again, I'm equally, guilty of like, "Ah, crap. Yeah, you're right. I don't
Right.
want to do this. I don't want to go see that doctor or do this or whatever." But going to the doctor is one of those things that has to go along with a larger, healthy lifestyle, and that putting people in place to help hold you accountable and help to make sure that you are healthy is good for you too. And so, but you want to reduce the amount of pressure you put on those loved ones, on and it's often for Black men, women in our lives who do that are doing that extra labor to take care of us and take care of our health needs as an expression of love and caring and concern.
Mm-hmm.
But that's extra pressure that we're not doing the same for them. And so we
Mm.
have to do a better job of reducing the amount of pressure expectation on them to do things like make appointments for us to go to the doctor. You can call the doctor's office as easily as they can. Like, so
Right.
why, like your phone works just like theirs is. So like
Right.
you need to, there's certain things that we can do to be better equipped, prepared, and so forth. So don't always rely on women in our lives to do those kinds of things. So, there are those negotiations. I'm not trying to tell, Black men how to live their lives and so forth. But what I am saying is realize that there's a cost on both sides. When you
Right.
don't take
Right.
care of it yourself, somebody is going to pay that cost and somebody is still going to step into that space. And you're putting more burden on folks that you may call yourself loving, and that may actually be harmful to the people that you say you love.
Very deep. Very deep. But and so then one of the things that maybe Black men may push back on as well, they may say, "Well, I don't have access to health care
Mhm.
because I don't have health insurance or what have you." So what are like 3 to 5 things that they could do actively to try to live a better healthy lifestyle until they do get access?
So one again, and with the Affordable Care Act, they at least can try.
Okay.
That's why it exists. That's why it was created. Um, you can be comfortable or uncomfortable with calling it Obamacare, but you can at least try to sign up for that and get you access to healthcare. Because again, there are going to be things that you can't find out by simply trying to live a healthy lifestyle by how you
Mm,
eat, what you eat, being physically active, and those kinds of things, being
and
vegan, whatever.
right, right.
You
And
can't.
not to cut you off, but what would be those things that someone could just say, "Oh, I'm good. I haven't been able to go to the doctor." What are some things they just won't be able to know unless they go to the doctor?
Your cholesterol level, your heart rate. I mean, how is your heart functioning? Is your heart in rhythm? You may not know you may be able to check like your blood sugar, but you probably won't be able to check, a larger marker of, how is your blood sugar on a more regular basis, um, at a level that is healthy, or is it too high and therefore needs to be changed by your lifestyle or something else.
Mm.
You may not know if you have cancer and you have something, cancers, things growing out of control in your body from different things. You may not know if you have kidneys. I mean, basically anything that is a diagnosable problem, for the most part, we don't know until you actually go to the doctor and get those things actually diagnosed by somebody who knows what they're doing.
Mm. Hmm.
And a lot of
Right.
things that don't bother us bother other people. So even if you get into like mental health things, you may just say, well, I'm just, I just do things my way. I'm just sort of, you can use that sort of grumpy, sort of old man or whatever. Um, but the problem is if it starts to affect your relationships with other people, the ability for you to work and those kinds of things. Because a lot of times
Mm.
we'll have those issues where it affects your social relationships and your work relationships. If it starts to affect those things, those are not just about your quirkiness or your deciding to have certain values. Those are things that actually a psychiatrist, a somebody who's a mental health professional can help you with. It's not about necessarily giving you drugs for it, but it is saying that those are things that by talking to somebody, by figuring out how you do those, there's a point at which mental health things about how you do things and how you live your life, how you communicate, how you function,
Hmm.
if they're starting to hurt other areas of your life, those are things that you need to pay attention to.
Okay. Yeah, and that makes sense. That yeah, and these are illnesses or diseases and that we could at least find out about. And if we're starting to feel the effects of them, then it's most of the time it's too late, and it's hard to I guess reverse.
Well, it can be, but a lot of things are not necessarily. I mean, medicine improves every day. About healthcare and so forth improves every day. We learn different things every day. A lot of things are have a lower bar than we tend to appreciate. So I always say that depression, excuse me, is a relatively low bar. Um, to have things like changes in eating, changes in sleep, changes in mood, um, you know, irritability, anger outbursts, and so forth within that being consistent over 2 weeks, that's not a very high bar for a lot of people. When you go
Hmm.
through some stuff, like that is not a, that's what a major depressive episode is. That is something that can be, that can benefit from you seeking professional help for that.
Hmm. Right.
But that is not what most people think of when they think of depression. They think of depression as being something, oh, no, you're sad, you won't get out of bed, and so forth. That's a more extreme version of it.
Mm.
But depression and a depressive episode that can actually benefit from care and from treatment and from support can actually be something that is as small as like I was just describing. You have five or six of those symptoms consistently within a 2 week period. That's considered a depressive episode. That's what people get treated for. So it's like the point is you don't know those things and you're not supposed to know those things because you ain't been to medical school. You haven't been to social work school to be a social worker to
Right.
train you haven't been to nursing. So lean on the people who have that information who you're not, I mean, so that they can also help you. It's a
Right.
team effort. So it's not like you still have the choice and decision to, once they give you that information and give you access to that information, oh, your cholesterol's a little high. Do you want to manage that by, taking this particular medicine, or do you want to try to change your lifestyle and do things differently about how you're eating and active and whatever to bring it down? And you can work with them to decide, okay, well, give me a couple of, months, 3 months, 6 months, and then let's look at it again. If I haven't brought it down, then okay, let's talk about this again. So
Hmm.
it's not, there's nothing, you're still in control. But the point is that going to the doctor should give you more information to make a better choice about how you're going to be in control of your own health and well-being.
Right. Right. And I think that's a great shift because we need to look at doctors as advocates for our own health and not the kind of end all be all. And I think that's where the shift is where doctors are seen as the authority all the time. And so if we feel they don't have our best interest at heart, where that may be one of the reasons why we don't go
Mhm.
as much because they're like, wait, how, they don't own me kind of thing.
Right. They're not in charge. And
Yeah.
you still maintain that ability to be in charge of what you're going to put in your body, what you
We lost your video. We lost your
okay.
audio. Oh, okay, it's back.
Okay. Unless you're in immediate danger to yourself or somebody else,
Mhm.
you have complete control over what actually happens to you in a medical care setting or not.
Right.
So but you're better informed because you have stuff that you can't tell by how you feel, that
Mhm.
you're not going to get access to that information by simply, looking at what you're eating, making sure that you exercise and do those kind of things where people try to have a healthier lifestyle. People have switched to, vegetarian, vegan lifestyles, and necessarily that hasn't, it can help with a lot of things with as it relates to eating and health and so forth. But you have a lot of folks who, because of the way that they're eating, have not been able to get all of the nutrients and all of the kinds of things that they need out of that
Mm.
diet.
Right.
So it's like you've got to make sure that you're getting all the access to information that you can, and all the different sources of information that you can possibly get.
Okay. Interesting. So since you are overseeing the Center for Men's and Health Equity, I wanted to address kind of the issues of racism and how it affects men's health.
Mhm.
Because one thing is that you hear is that men are, women kind of do suffer some of the same issues as far as being how they're treated, especially when it comes to maternal health and things of that nature.
Mhm.
But they're not having the same. They're not dying of those diseases at a higher rate than we are. So why is that, and how does racism kind of play a part in that?
So we don't want to sort of get into what I would sometimes call the oppression Olympics. Like, we're not competing with black women to see who gets it worse, in American society. Black women have it's just different. The racism, and particularly we should name it as anti-black racism, is really different.
Okay.
The expectations, the stereotypes that black women experience, and the reason have a similar root in anti-black racism as it applies to men, as it applies to women. They're just different in how people see them. We tend to Black women tend to get seen as more exotic, but you still have a lot of the things where their bodies are seen to be their pain tolerance is supposed to be higher than, say, for example, other women.
Mm.
So they may not get access to the same kind of pain medication. They may not get the same aggressive response when they say they're in pain, whether it's in labor, whether it's in other areas of their lives. They may say, oh, well, you'll be fine. You can handle it better. You still have some who think that black people's skin is thicker and whatever. So there all these stereotypes that just look different in the lives of black men versus black women. It's not clear, and we're still trying to better understand, how much the racism that black men experience um, is interesting and complicated in and of itself. One of the scholars, her name is Adia Wingfield. She's now at, I think, Washington University in St. Louis. Wrote a book some years ago called No More Invisible Man, where she studied um, black men who were essentially in white collar jobs, higher income, whatever jobs. And she came up with this term called partial tokenism. And the reason I'm going into this is because there's some advantages that men by definition in the US, we make more money, tend to have um, well, the education is actually getting more complicated, given some
Right.
recent data and so forth. But there are a lot of advantages to simply being male in the United States. It's not as universal as we once sort of understood and thought, and some of the changes have actually started to hurt men in their not just health, but in terms of education, income, and so forth. We have higher rates of unemployment, and so forth.
Right.
So it's
Right.
the point is it's what I'm saying and not saying is it's not a straightforward sort of thing. Yeah, I know this keeps going now.
Mhm.
Um, and it's just different from black women. So we just want to be careful to not compare. It's really that they're just
Right.
different.
Okay.
And so when it comes to black men, I think the racism we experience, it builds on a lot of the stereotypes. And one of my favorite other sort of um, issues as it relates to this is Elijah Anderson, who's a sociologist at Yale University, wrote a book called "The White Space," and there's a subtitle to it. But he came up with this concept that there are places that Black people have to go to and engage in, and spaces we have to go to, like the doctor's office, um, like employment settings, like other spaces that are um, not race specific, that were not necessarily designed for us to be there. Political office, um, and so we don't get treated with the same. You get treated like you're an outsider, even though you actually are supposed to benefit from being in that space as well.
Mm-hmm.
And it's supposed to be accessible to you, but it in fact is not, and it wasn't designed for you to be there. Academic institutions, unfortunately, are another one of those spaces, and so higher ed and so forth. Even, we see a lot of the issues with even in elementary, middle, and high school with Black children, particularly Black boys, getting higher rates of expulsions and other the response in those
Hmm.
spaces tends to be disproportionate to what they've actually done. And so the point is like the way the anti-black racism plays out is very much gender, but it's also context specific. And so all of those things, even if they're not health specific, have implications for how much stress that we're under, for the kinds of things that are affecting our health and well-being.
Okay.
Because if you're constantly under stress, if you're constantly preparing yourself to, okay, here I got to go deal with this crap again, or you're in DC around the idea of around some election cycle, and you're like, okay, am I gonna have to walk out the house and hear somebody say something stupid about the election, or about
Hmm.
some assumption about who I'm going to vote for, or some assumption about you know how critically I'm going to look at the candidates and whether or not I'm going to vote for somebody just because they tend to favor black candidates, or because I've actually done a more critical analysis and I realize, no, this person actually does have more of my interest at heart. But yourself for things that you may not actually experience. Nothing stupid may actually happen to you. Nothing racist may actually happen to
Hmm.
you.
Hmm.
But because you built your body up and you sort of put yourself on guard, you don't put your fists up and so forth, your body is responding. It's sort of having that preparatory fight or flight. And
Hmm.
so because we kind of start to have that it wears and tears on your body. Um, and so that type of what a colleague of mine, Arlene Geronimus, characterized as weathering. So if you think about just the wear and tear of being outside in bad weather and so forth, that it has negative effects on you just by experiencing it that much. Those kinds of things have implications for your health. And so how you respond to that, how you deal with that, we have to just be mindful of that and take the time to heal, protect ourselves, create safe spaces for ourselves so that we can be ready to deal with those kind of things when they do come.
That's interesting to think about because I was in a previous um, position, and some of the things that I felt were internal in my body, and I didn't. It took me a minute to understand what was happening, but now hearing you say because of because of the environment of which I was going in, my body was reacting to that, and not being able to, and there was nothing that I could really do about it unless I made changes
Mhm.
to, you either change your environment or find ways to manage that. And we in our communities, maybe because we're not equipped with those tools, we think it's symptomatic until it goes away or until it has some larger implications on our
Or
health.
or it's simply not an option for you to avoid that setting.
Yeah. Yeah.
Like you got to go to work, and you know that. I mean, we just saw this unfortunately with the Lincoln University issue with the woman who was in a high ranking position and had the issues with the president, and unfortunately died by suicide because she was getting so much pressure and just having so much of a negative experience. I'm sure some people would say, why don't you just quit the job? And I don't know enough of her life circumstances and whatever, but a lot of people just can't quit a job just because they treat you like crap. And it's not an option to just not do it because your other people are counting on you to fulfill
Mhm.
those responsibilities and so forth. So it's not
Right.
as simple as I'm just not going to deal with that today, or I'm just not going to go there. Like you've got to, you know, man or woman or non-gender binary, you got to, fulfill responsibilities that are important to you.
Right. Right.
And that's going to put you in some cases in harm's way in ways that we don't always fully appreciate when we talk about, we give simplistic explanations for how we should handle certain situations, not realizing that all of those are not on the table as options for people to engage in.
Right. 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 Okay. Two more things that I want to talk about.
Mhm.
Because I was looking at, we just had November that came out. I guess November and November, but we passed that. But they had 5 things every man should know and do. So I just wanted to go over these categories and see what you think about them. Especially for Black men. And one of them was spend time with people that make you feel good.
Definitely. I
Yeah.
mean, yeah, you can't live your life just thinking about yourself as an instrument, as a tool to help care for, put food on the table and do all
Mhm.
those kind of things. And unfortunately, in middle age in particular, when we sort of shift, usually from is middle age is usually when you shift from a very much a me focus to a we focus. So middle age, it tends to be when you start to have family, when you start to have you're trying to usually, if you're going to have a career instead of a series of
Mhm.
jobs, you're going to try to build that. You may have a partner, life partner, and so forth. But it's you start to have to consider other people. Whereas in adolescence, um, talk about extended adolescence, but you
Right.
can be in your 20s and you're still very focused on, oh, all I got to do is take care of myself. But you have to find people who feed your spirit and at least help you, allow you space to be you. And so, yes, that is a critical one.
But
I know that.
that's interest not interesting, but that's one of the things that we don't do as well. We
Hmm.
don't we don't have our community of men, maybe five, 4 or 5, where we can hang out and enjoy each other's company, and maybe in a variety of different things too. We might be able to connect over the Super Bowl, but in regards to just everyday, more regular events, we can't do that, and
But that's
we don't do that as well.
hmm And that's again when we talk, because we were talking, before we actually came on, about our Mighty Men program and some of the other sort of interventions that we've done. Part of the reason that we do interventions to promote health and well-being of Black men in small groups is to create some of those spaces that are not organically being created in our lives. And
Hmm.
particularly, again, during this phase of life where you are in your 30s, 40s, 50s, and even sometimes 60s, we don't, like you're saying, we move out of the space where we prioritize making time for those friendships, for those relationships, where you are just doing things that make you feel good and working and being with friends that make you feel good.
Okay.
And so we've got to find, it's, as one of my community mentors used to say, it's a both and, not an either or. You've got to still make time for those things that feed you and feed your spirit while you do those other things that are also important for you to be accountable, responsible for other people in your life.
Hmm. Hmm. Okay, and then another one was talk more. So that
So
means
that
we're
that
just
one is that one is a little like so one, it makes the assumption that men don't talk enough. And if you actually, I kind of push back on that. It's the same thing that people often say, that men don't seek help, get information, they won't talk about their problems, that the reason that the rate of dying by suicide is so high among men is because we won't ask for help and so forth. When you actually look at the data, when you actually talk to men themselves, that's not actually true.
mm,
um, Most of the people who die by suicide have reached out to somebody else for help in the weeks to months prior to that. They've actually explicitly expressed the need for help, gone and sought help, and it has not, even professional help, and it has not necessarily yielded them not doing what
mm.
eventually led to their demise. So
So it's
talking is
so
not
it's a
is
matter
not
of matter of people listening.
right. It's
Yeah.
it's the same thing as we are talking about with information, quantity and quality. Like, talking more is not the same thing as talking and having it be a better relationship, having you feel like you've actually been heard,
Hmm. Hmm.
having you feel like it was actually supportive and somebody actually understood your pain, your experience, your stress, who you are and what you're actually trying to achieve. So more in and of it, I get they're trying to make these things pithy and quick,
Right.
but
Yeah.
it plays in too much into a narrative that I don't know that we're finding is quite as true as we always once thought.
Okay. Okay. And then the other one, which is also, and maybe it's a little pithy too, but knowing knowing your nuts, but I guess it's basically
Well,
knowing
that's
as
about
far as
screening.
the
Yeah.
screenings. Yeah.
Well, that's, yeah, because testicular cancer tends to be something that men die of, particularly in younger years, um, and that prostate cancer, depending on where um, yeah, I mean, it's important. You need to know.
Right.
I would say know more about your health more generally than even just thinking about,
Right.
you know,
That, just that.
nuts. Yeah.
And I guess that the one thing is that, take out the, I guess, for lack of it, the homophobic part of the because it's about checking, and you need to know,
Mhm.
what those issues are, because of course that's not something that you're going to be able to see, and it's easily treatable.
Well, there are things that are like what they're the part of the principle of what they're saying is you should know again what's normal for you.
Right.
So it's helpful again for you being a good partner with your doctor and nurses and so forth for you to know I'm not used to having this lump here. This is not normal that this thing is here.
Right.
Me going to the bathroom 15 times a night, that is not normal for me because there's aren't the version of normal for you is going to be different than other people.
Right.
So
Right.
it's a getting comfortable and knowing your body, knowing what is normal for you, so that when you go to people, that they are not putting stereotyping in a way or just saying, "Oh, you're a man who fits these particular criteria. I'm going to assess this in this way." Like you have to understand what they're actually saying is relevant to you, and you need to be able to give them information about, here's what is normal for me, and it just may be different where certain numbers don't apply to you in the same way as
Mhm.
it does for somebody else.
Okay, and we kind of covered the move, more know your numbers, so to speak. And the other one is just move more.
Mhm.
Um, and so I guess we've kind of covered that too,
Well,
because
but just to say that physical activity has benefits that are more than just what happens to your physical health. It's actually it's hard for people when they're depressed or have negative moods and so forth to find the energy and the motivation to be active. But when they've been able to do that, it actually is as effective of a treatment of depression as as medication and
Mhm.
sometimes as counseling. It has benefits for just not just your health and your heart, but it has benefits to your overall well-being in ways that we don't always fully appreciate. So being active is really important um,
Mhm.
for benefit, and even if it's in small bunches, small doses, and so forth, we have to find ways to do that. Um, as much as you have to eat, you don't have to move. Um, it is important to make time to move and make that a priority as much as we do with eating and so forth. And knowing your numbers, like you're saying, um, is finding the age appropriate. What are the things that you need to know about that are put you at it's cancers and heart disease are the
Mhm.
two cancers, heart disease, and diabetes, which is a risk factor for heart disease.
Right. Right. Well, Dr. Griffith, this has been very informational, and this has been great. I'm thank you for being on today. And before you go, I always like to end the show with this question. It's always a surprise, because I really want to just get your raw response. Because we're always, as Black men, and are doing so much, or we take on a lot, in our lives, and we don't necessarily think about, ourselves and what we need. So the question I have is for you to answer is, as a Black man, how are you feeling right now?
Hopeful.
Hopeful. Okay.
Yeah.
Then why hopeful?
I don't like the alternative. Is
Okay.
is one answer. Um, in my own personal life, things that have taken a while for them to materialize as opportunities are now starting to that I've had to be patient with, and I'm not always good at being patient. Are start that patience, whether I've had it or just been forced to have it, um, have started to yield bear some fruit. So, and I think it's just it's hard to in this particular moment where there's so much. It's really hard um, to anchor yourself in anything other than positivity and hope.
Okay. Well, that's great, and I thank you for coming on today and informing our population that's watching either today or will listen on the podcast. And I look forward to hearing more about the Center for Men's and Health Equity, especially since it's at Georgetown, and all the great work that you're doing. So thank you.
Thank you. My pleasure.
This is Keith Dent from the Black Men Speak podcast. Look forward to seeing all of you soon, and you guys have a great night.